I thank the County Recorder's Office for selecting this very important topic today for a topical issue. Minister, great concern. There is great concern, and has been for some time, as you are aware, in both the Laois and South Kildare area regarding future healthcare services at Portlaoise Hospital. Many of my constituents would view the emergency department in Portlaoise as their natural place to go if there was a need for attending an emergency department, and also many of my constituents have used the maternity services in Portlaoise, as many Kildare people and people on the border would go there for maternity services and for delivery of babies also. From Athy, Monasterevin, Newbridge to Portarlington, Jamestown, Kilnard, the people see Portlaoise as their local hospital for emergency department, intensive care unit and maternity services. First and foremost, we must ensure we have the safe delivery of services, and that the services available to the public of Laois and South Kildare are of the highest standards. Previous HICWA reports showed deficiencies and risks to patients following the death of baby Mark Malloy. I recognise the update from HICWA last December that pointed to maternity services now being improved for in a safer way, the delivery of those services, but there are still issues with understaffing and recruitment of non-consultant doctors. HICWA have pointed to the need for a strategic plan for the hospital and its future. We now then have a leaked report which has been reported in the media, which again is causing huge concern locally. Minister, there are a number of things that the people of Laois and South Kildare need and deserve. One, we need clarity as to the future plans for Portlaoise Hospital. We need the safe provision of healthcare services in our area, and we need a plan for the delivery of increased investment to ensure the safe provision of emergency and maternity services for the people of the area. Thank you.
I want to thank the deputies for raising this matter. At the outset, I would like to reassure the deputies present that, as my colleague, the Minister for Health, has stated previously, the most important issue in relation to the consideration of services at the Midlands Regional Hospital, Portlaoise, is that patient safety and outcomes must come first. Minister Harris is committed to securing and further developing the role of the Midlands Regional Hospital Portlaoise as a constituent hospital within the Dublin Midlands Hospital Group. He has said he will bring clarity to this matter in the coming weeks. Reports on Portlaoise Hospital in recent years have pointed to the need for restructuring of some services to ensure that patients are treated in the most appropriate setting by specialist staff that can safely meet their needs. Since 2014, the focus has been on supporting the hospital to develop and enhance management capability, implementing changes required to address clinical service deficiencies, and incorporating the hospital into the governance structures within the Dublin Midlands Hospital Group. Significant work has been undertaken to strengthen and stabilise current arrangements for services at the hospital to ensure that services currently provided that are not sustainable are discontinued, and those that are safety assured and adequately resourced. The HSE has confirmed that hospital funding has increased by 28% relative to the 2012 budget, and staffing levels have risen by 29% from the 2014 base. Funding of €300,000 has been provided in 2017 to facilitate the opening of the new medical assessment unit. In addition, governance and management arrangements in Portlaoise Hospital have been strengthened, additional clinical staffs have been appointed, and staff training, hospital culture and communications have improved. The Dublin Midlands Hospital Group has been working for some time on a draft plan for a new model of clinical service delivery at Portlaoise Hospital. A draft plan was submitted to the Department of Health in December 2016. This draft report was reviewed in detail and was the subject of detailed engagement between department officials and the HSE. Significant additional work was undertaken by the HSE on foot of this engagement, resulting in a revised draft plan that was submitted to the department in September 2017. I would like to emphasise again that patient and public requirements are paramount and have underpinned the department's consideration of the draft plan. The report is currently under detailed consideration in the Department of Health. Once there is an agreed position on the draft plan, it is intended that there will be further engagement with all interested parties to ensure that the needs of patients, staff, the local and wider community are addressed. Any future changes to services at Portlaoise will have to take account of existing patient flows and demands in other hospitals, as well as the need to develop particular services at Portlaoise in the context of the overall service configuration in the Dublin Midlands Hospital Group.